In today's morning rounds, we are looking at why mental health care is not always covered by health insurance. We partnered with Kaiser Health News and NPR on their Bill of the Month series, which uncovers shocking medical bills, and shocking is the word. The latest explains how an Illinois woman owes tens of thousands of dollars after a mental health crisis and a very unexpected hospital stay.
It's just, one thing after the other.
Arlene Phelan was mourning the deaths of her father and husband when she received a third blow.
The cherry on top of the cake was when I lost my mom. That's when I'm like, God, just can't. How can I do this?
After an emotional Mother's Day, she spent a night drinking and texting. A worried friend called 911. Phelan was rushed to a hospital in the Chicago suburbs, where she spent 4 nights in the psychiatric unit.
I kept asking questions. What is this going to cost me? I'm underinsured. I am insured, but I'm underinsured.
Phelan had purchased a low-price insurance plan that's not part of the Affordable Care Act, and it does not cover mental health.
I'd say 6 to 8 weeks to receive my initial bills. And I keep getting bills. They're still coming. There you go. Wow!
Phelan's initial hospital bill covering behavioral care, lab work, and room charges totaled nearly $30,000. The ambulance was an additional $1,400. Northwestern Medicine Central DuPage Hospital later reduced its charge by almost $9,000, leaving her owing $21,634. The hospital tells CBS News, quote, "We have tried numerous times to connect with this patient to provide guidance and assistance. Our follow-up efforts remain active, and we hope to hear from the patient soon." Phelan's sister Kathy is helping her navigate her bills, but Phelan says she's worried about collection notices every time she picks up her mail.
It adds some stress and some fright, actually. What's next?
Never good when you don't want to pick up the mail. The editor-in-chief of Kaiser Health News is Dr. Elisabeth Rosenthal. She joins us now at the table. Good to see you, Doctor.
Thanks for having me.
So she said she had insurance. Did it turn out she just didn't have the right kind of insurance?
Yes, for financial reasons, she bought a cheaper kind of health plan called an association health plan, which you can opt out of certain kinds of coverage, so psychiatric care, mental health care, prescription drug coverage. And under the Affordable Care Act, those plans were considered junk insurance or skinny plans. And what we see with this story is if you opt for that plan, you're leaving yourself vulnerable because you can't really predict what kinds of health care you're going to need.
Aside from the low cost, are there other reasons people choose these plans?
Mostly because they don't understand what kinds of gaps they leave them vulnerable to, but it's mostly a cost thing. With premiums and deductibles going up, a lot of people look at the ACA plans and say, oh, I just can't afford it, so this is better than nothing. And better than nothing, but if you have certain kinds of health conditions that you didn't predict, you're totally vulnerable.
So if you find yourself in a situation where you have a skinny plan, the plan didn't cover it, everything, and you've got thousands in bills, what do you do?
Oh my gosh, you're in a bad position because basically you're vulnerable. It's kind of a double whammy. You don't have the insurer to pay for the service, but also you don't have the insurer's negotiated rates, which in this case, the rack rate was $30,000. Most insurers would have paid maybe $9,000. So, they gave her a 30% discount, great, because she was uninsured, but that's still $20-something thousand and unaffordable.
But how do you know you have a bad plan? I think she's thinking, look, I have insurance, I'm covered. How do you even know you've got something?
As every time I come here, I say, buyer beware, right? You really, really have to know the limits of your plan. And, P.S., when you're in a mental health crisis, you need care. She's better now. It really wasn't an option to stay at home. So this is one of those situations where we leave patients in really untenable and unaffordable positions.
All right, Dr. Elisabeth Rosenthal, thank you for joining us today.
Thanks so much for having me.
For a full link to the Kaiser Health News story, go to our website, cbsthismorning.com.